Hi everyone, I am Diana, Communications Assistant for the City of Enid, and special guest with me is Counselor and Executive Director for ATS Counseling, Rebecca Kroeker. Rebecca, thank you for joining us.
Thank you. Thank you for having me.
Now, Rebecca, this has been an emotionally charged couple of weeks. How, in your opinion, everyone reacts differently to COVID-19. Does stress affect people differently when it comes to this pandemic?
It definitely does. It kind of depends on someone's resiliency and what coping skills they may already have in place. But we're seeing a huge difference in some people who are adjusting just fine and rolling with things, and then others who, it's triggered panic attacks within them, and very negative thought processes that are kind of dominating their day-to-day interactions with others.
Now, how people cope, does it really have to do with the background? Like a response to a parent would be different from a response of a child?
It can. I think there's two factors that come into play with that. There's nature versus nurture. So some people are born genetically as more anxiety-prone people, people with lower levels of coping with things. Then some people are born very resilient and can bounce back from stressors. So then also comes the component of modeling that parents may bring to the table, or caregivers, where maybe a parent is very anxious or struggles with coping, and then kids will learn those kind of maladaptive ways of interacting with their environment.
And even within the same background, as in one parent to the next, stress will still be different. Well, how individuals cope with stress will still be different.
Definitely, definitely. So where one parent may see their child, even in the same household, see one child who is adapting very well to the changes to their schedule and loss of activities and playing with their friends, they may have another child in the home that's really struggling.
What kind of stress are you seeing more during this pandemic? Or I guess what symptoms? Anxiety, depression, panic attacks?
Yeah, I'm definitely seeing all of those with adults and with kids. With adults, they present a little different. Maybe changes in sleep patterns, sleeping too much, problems staying asleep or falling asleep, or tired during the day, problems with just no motivation, really struggling with adjusting to things. Like you said, panic attacks. We're seeing people who are really struggling with those. With kids, we're seeing, for the kids that are struggling, we're seeing increased levels of irritability, some clinginess, progressive behaviors, maybe some baby talking, or a child who's been potty trained the last year may have some regression. The change in schedule, it really, rattles things for kids.
Yes. Now, what can we as adults do to help cope with this stress?
So as adults, first we'll start with, if it has to do with kids, is try to shield them from things that aren't age appropriate. Of course, they're going to need to have some answers because they're no longer going to school. They can't interact with the neighborhood kids like they've normally done. Parents are encouraging them to wash their hands more. But there's things that maybe they don't need to know about, like if there's financial strains in the family right now, those would not be age appropriate stressors for a child. I always say that a kid should be worried about like their transformer breaking or their Barbie doll head falling off, not about if the electricity is going to be shut off.
Now, everybody is at home, both many adults and kids. What about social media or the news? It's important to stay informed, but when is it time to unplug?
I think it's time to unplug when you feel like it's impacting your level of functioning. If you're becoming, a little bit too obsessed with the data and the information that's being put out there. I think that it's about balance for people, that they continue to have their daily balance of doing work-related activities, doing family-related activities. I think that also, just being plugged into the correct things that we should listen to. There's so much out there in social media and on the internet that might be skewed to one political side or another. And to, go to the CDC website or the World Health Organization website to get some information that may not be skewed towards a political side.
Now, is it good for structures in adults and kids to have structure, like a routine, eating healthy, maybe having some time outside, make sure you're sleeping, getting enough sleep? What do you think?
Definitely, I think structure is helpful for all of us, even if we're not going to work that day, but getting up, taking a shower, getting dressed for the day like we normally would when we'd be leaving the home for work helps prepare you and put you in that mindset for the day ahead. Vitamin D is so important for not only our mental health, but our immune system. So getting out, raising the blinds in the morning, getting that sunshine brought in, going for a walk, those are all good things that we should continue to do, probably even more so now than before.
Now, there's been something controversial brought up. Golf courses have made it onto the essential list of essential workplaces for the community. Now, this is mainly an isolated sport. It's not contact sport like basketball or football. Now, some may say that it's unfair. I was like, but does it have positive input into mental health?
I think definitely it does. I think that as we all do daily things like go and get gas for the essential things that we have to do, hopefully we're taking precautions with wiping down the gas pump and washing our hands when it's over. With golf, that's something that is a hobby for a lot of people. They're outdoors getting vitamin D. So I can definitely see both sides to that. I think that whatever we can do to still maintain some level of normalcy is good, but at the end of the day, I'll leave that up to the medical professionals and the community leaders to decide if that's appropriate or not. But I do see the benefits of things that we can do in isolation on our own with our hobbies and with being outside.
Awesome. Now focusing back on children, what are some things that kind of stress that it's normal to see in a child, and what draws the line in red flags? Like there's going to be some anxiety, some irritability, and like you said, some regression if they are being toilet training, some regression in that. But what draws the line to red flags and when it's time to seek for help?
I think that if a parent feels like it's more than what they can manage within the home, that it's a good time to reach out for some extra help. Maybe even if it's just a consult on some different ways to present or parent differently during these times. What may have worked a month ago for parenting may not work at this time. And also just giving that extra attention and love, because our kids are going through a lot too. And sometimes we forget that that they're struggling. We get into, as parents, sometimes we get into taking care of our own fires throughout the day, and we forget that things such as play are really important to kids and a big part of their life and their day. So if you feel like you've exhausted, your resources around you, and maybe others have noticed the change, that may be a good time to reach out.
Now, being a role model for your child, is that a support for your children, watching how you react to media in the pandemic? Would that help with that structure and also with even lessen the weight of anxiety?
Absolutely. And I would definitely restrict what you're watching in front of the kids. I remember back in 9/11 that there were, my kids were very young at that time, and I had to really monitor what I had on TV, because people were being diagnosed with PTSD just from the exposure of seeing that trauma. And there's, we can traumatize kids by what we're seeing or what we're exposing them to. So I would definitely, monitor what they're being exposed to and model good ways to handle stress and help them learn different ways. One really good way to do that is reframing, cognitive reframing, where you take a situation, you teach your kids. As adults, hopefully, we should try to implement this coping skill as well, where we see the silver lining at the end of the day.
Yeah.
So for my daughter's home early for my WSU, so that's a positive, at least for me right now, where I get that extra time with her. We're trying to start new family rituals. I've noticed there's an app that some of you may be familiar with called TikTok, and families are getting together and they're doing silly videos.
Yeah.
And this would be an excellent time to start some new rituals that you can do with your family, and quality time that you could spend with them. So it's showing kids that we can see the positive in a situation and not just focus on the negative, because there's a lot that could bring us down right now mentally. There's a lot of things that we're struggling with in our community. And so if we can try to see some positives and make lemonade out of lemons, then that's a good coping skill that we can model for our kids.
Thank you. Now, for adults, there is a tightrope that we walk when we have children. So not only reframing with our kids, but also limiting social media. How about eating? How about sleeping? Is that something we should also role model for kids?
Yes, definitely. Keeping kids on a schedule. I can admit firsthand that I was guilty with my son not taking away his electronic devices last night. And I walk up there at 9 o'clock this morning, he's still in bed and he was supposed to be logged into a class. So definitely keeping those schedules is going to be super important. And know that we as parents, we're not going to be perfect. We're going to make mistakes, and that we bounce back and just try again the next day. I've seen a lot of posts from teachers who have said that, that your expectations may be up here, but that may not be the reality of what we're dealing with right now. So give yourself some breaks and try again the next day and keep working to get through this time.
Thank you. Now, for the adults who feel overwhelmed, stressed, they have fear and anxiety, and they feel that it's affecting how they take care of their family. What do you suggest there? What are the red flags, and what kind of help is there for them?
Yeah, I think that, again, number one is if you feel like everything that you've done to help is not helping lift your mood or help you get through this, is one thing to consider. If it's causing significant distress in your daily functioning, that's another thing to consider. So if it's impacting your ability to, get through a work day or communicate effectively to others, look at that. How is it affecting your daily level of functioning? And if it is, then at that point, I would assess if maybe that's something you should consider. If you feel like you've exhausted your family and friends, you need someone outside of that support system to talk to, then that's another thing to consider. If other people have noticed, then that can be a good indicator. And then lastly, if you're abusing something to get through the day, whether it's alcohol or some type of drug, food, gambling. I know that we can't go to the casinos now, but there's people who do online gambling, online shopping. If you're using things to fill up that void, that would be a good time also to seek out services.
Thank you. Is there a correlation between the financial struggle that we're seeing in this pandemic and mental health?
I definitely think that, whenever people have financial stressors, then that's going to affect their mental health. Maslow's hierarchy of needs is a good example where, the first need that we need to have met is our need for, food and shelter and just those basic necessities. And if we don't have those met, or if we feel like those are being threatened, then it makes it difficult to work on things like happiness and feeling content with our daily life. So there's definitely a correlation between that. And reaching out for help, so important. I would say 20 years ago, there was this huge stigma having a counselor, but I've really seen in the last, I would say 5 to 10 years, a shift of, can almost be a status thing for some people. I have my therapist that I talk to. So I think that that's a a positive thing, that people are no longer seeing mental health or just adjustment issues in general as being a negative thing to reach out and get help.
Have you seen an increase of clients?
We have. There's a lot of people reaching out for help right now. I think that, going web-based, which we've done, has made it really accessible for people. They can do it from the privacy of their own home. And I think it's been a really, a strong benefit. Where before maybe people were a little bit concerned about using the technology, now they've been faced with having to jump in. And maybe they were having to use it for work or different ways of connecting with people. So it's definitely been something that people have utilized.
Now, ATS Counseling specifically has groups, support groups like Empowerment for Women. How are you guys grouping everyone together where they still get that support in this time?
Yeah, we're using confidential web-based services where they have to have a password to get in. And so we're continuing those groups with social or with web-based technology so that we can continue those services.
Okay, now, what if someone does, well, many Americans and around the world have gotten COVID-19. There's a stigma with COVID-19, and it goes from either extreme, from carelessness to death threats. How would someone who has COVID-19 cope with that stress?
Yeah, I think that would be on a case-by-case basis, but definitely utilizing your support system. If you feel like you're being bullied or harassed through social media, maybe shutting down those accounts temporarily, but kind of assessing your own personal situation and how it's impacting you. Because I agree, I've read a lot of stories with people being harassed and being attacked verbally by neighbors and having threats, and it's just a sad situation. Nurses being yelled at. Yeah, it's a difficult time. People are acting out in ways that they typically wouldn't, for sure.
Yes, that's true. Now, after all this is said and done, do you think that this will help with resiliency?
I think it could. I think that we're going to see some positive changes with just basic things like how we care for ourselves and hand washing and people, coming together, hopefully, that we're going to see people relying on each other through alternate means. You see people sewing masks for each other and really supporting each other in a lot of amazing ways. People are posting on social media. If you need anything, don't hesitate to reach out. I think that we're seeing a lot of community and solidarity, and I hope that continues.
Now, do you think that some individuals struggle more, like if it's extroverts versus introverts? What's your take on that?
I do, but I think that it's hard for introverts and extroverts in different ways. Where extroverts tend to feed energy off of other people in large groups, introverts still like connection with other people. They just usually like smaller groups, maybe one-on-one, 1 to 2 activities. So I think that we're all struggling with the isolation and not being able to continue with our daily activities in the normal ways that we're used to. I think, it kind of depends on the individual and what they're doing to keep their life in balance as well as they can during these trying times.
Now, what is ATS doing specifically to help during the pandemic?
Well, we've had some different companies reach out for us to put together some information on coping with COVID-19. So we've been putting out material through several companies in Enid that have EAP contracts. We've been providing information through social media, and then just making sure that our services are accessible for people.
Awesome. Now, that is all the questions that I have, and I don't see any online questions here. Now, is there anything else that you want to share before we close out?
I think it's just important to remind people that if you need help, check with your insurance company, check with your employer. You may have employee benefits that you're able to utilize. If you don't have a way to pay for services and you feel like you need those, a good starting place would be Northwest Center for Behavioral Health. That's our community mental health clinic. and they're subsidized by the state of Oklahoma. There's another great resource, which is 211. And you can call 211 off of your phone, or there's a website. I believe it's 211.com. I'd have to dig that up. But if you Google 211 Oklahoma, you'd be able to get that website. And that 211, what it does is it can link you to local community resources that could be from utility assistance, rent assistance, if you need a mental health referral. It's a great resource for people to use.
Thank you, Rebecca, for your time. Thank you for joining us, and thank you for all the information that you have joined, and thank you for what ATS Counseling is doing. And we will be in touch if we need to bring you on, and if there's any other updates that you want to share with us, we would be glad to have you again.
Appreciate it. Thank you.
Now, to the viewers at home, I want to remind you that we are having daily COVID-19 updates tomorrow. Please join us at 1:30 with Lisa Powell, ERDA, and relief programs for businesses. Thank you.